Philippines is the country's leading healthcare facility for respiratory and related diseases. Strategically located in the heart of Quezon City, LCP is a government-owned and controlled corporation established through Presidential Decree Number 1823 on January 16, 1981, which aims to provide the Filipino people a state-of-the-art specialist care for lung and other chest diseases. LCP had served over 15,000 inpatient admissions, which comprised from different regions of the country. Each year, the center handled over 18,000 outpatients and clinic visits with an average of 144 inpatients per day. The hospital has faced significant challenges in the past decade. Now, the lung center of the Philippines share a much brighter outlook, thanks to the tireless efforts of the hundreds of people in every level of organization. This roadmap will guide them forward to the next 5 or 10 years. That plan is based on the mission and vision. These statements are the cornerstones on which hospital will build their future successes. The mission and vision are critical pieces to any organization. The mission statement identifies the core purpose of the organization. The vision statement focuses on the unified goal to ensure we are all moving in the same direction. I would like to share the Lung Center of the Philippines mission statement. Number 1. We provide quality healthcare through state-of-the-art facilities and highly competent and compassionate staff for the improvement of the Filipino people's quality of life. Number 2. We provide immediate attention to every individual in need, regardless of creed, color, sex, socio-economic status, and political affiliations. Number 3. We endeavor to achieve financial stability and long-term sustainability. Number 4. We are dedicated to lung health promotion and advocacy. With that, I introduce the vision statement. The premier institution for lung and other chest diseases, providing quality health care through excellent service, training, and research. With the competence, compassion, caring, and dedication of its people, the Lung Center of the Philippines will continue providing the most effective pulmonary care and service to Filipino and patients from other parts of the region.
The Lung Center of the Philippines, or LCP, provides several medical facilities and services. It provides basic services such as 24-hour emergency room, laboratory, radiology and pharmacy services, in- and outpatient consultation, ECG, ultrasound, nursing care, surgery, and physical therapy, and many more. To feature some of the basic services, we have the outpatient department, which you can see the receiving area for all outpatients, which is open from Mondays to Fridays and provides frontline services. Secondly, we have the physical therapy and rehabilitation department, which some of their services offered are pulmonary rehab, pre- and post-operation physical therapy, wellness program for chronic lung diseases, and stroke and other neurological rehab. And lastly, we have the hyperbaric medical facility and wound care center, where some of the services offered are conventional radiation therapy, radiotherapy, hyperbaric oxygen therapy. LCP also provides advanced services, first of which is the state-of-the-art equipment, the Video-Assisted Thoracic Surgery, or VATS. This equipment is used in minimally invasive surgery procedure for the diagnosis and treatment of lung diseases and tumors. The usage of this equipment will result in better quality of life due to faster recovery time and reduce the use of pain medication. In 2013, LCP unveiled a new sleep laboratory for patients with sleeping disorders. LCP is the first hospital to acquire the new sleep study equipment, the Philips Alice 6 Polis Monograph System. Doctors now can easily diagnose obstructive sleep apnea or OSA and all kinds of other sleep disorders as patients undergo a simple process of sleeping through the night. The center also introduced autologous stem cell therapy, which offers a promising area of hope for the amelioration of many diseases for which this has previously been no cure and minimal hope of prevention.
One of the integral parts of the company's support services is the Information Technology Services Department. The unit's primary function is to help hospital management in harnessing information technology resources in order to provide complete, accurate, secure, and timely information for a more competitive and efficient administration of the activities of the center. Since the Information Technology Services section doesn't have any mission and vision and goals, we have created the vision, mission, and goals for the said department. The Information Technology Services mission is to be the integral part in the achievement of the company's vision and mission through providing the appropriate information technology and services to meet the business goals. For the Information Technology Services mission, the strategic role of the Information Technology Services section is to be a provider of a quality information technology through providing state-of-the-art facilities for companies' use to provide a strategic advantage in our business markets. Another mission is to be a provider of quality information services, the infrastructure, and environment that assures the company wide knowledge sharing that meets customer requirements. The third mission is to be a partner with several business units to facilitate the ability of timely and accurate information needed to manage the day-to-day and strategic direction of the company by the deployment of systems and tools. The Information Technology Services also has strategic objectives that we would like to let them use. One is to execute the information system's vision and strategic plans. Two is to make the information systems department communicate with the other departments to effectively and efficiently manage the hospital's information system structures. 3. Provide the correct details on systems, services, and information system technologies to help the company meet the business requirements for their next ISO inspection. 4. Is to support the Lung Center of the Philippines' objectives and goals by providing effective pulmonary care to patients, posting impressive gains in virtually all services being rendered. And 5. Collaborate with the company's support programs and support services to fulfill their information system needs using their hospital management system. The strategies that we would like them to use is to realize the vision, mission, and goals of the center as a major investment to information system should it be acquired. This includes positioning the current information systems to provide the most competitive advantage in the medical industry. The center should formulate an effective strategy that is more appealing to the information system's resources with regards to its people and budget. The information system team can start using currently implemented strategies, which is a huge system evaluation should there be done to know whether the center will settle with the lowest cost solution or if a more expensive solution tool will be used? For information system and business goals, the center should be able to design a system that customers can easily and directly interact for customer delight. And the center should acquire a hospital information system tool that can integrate the support services and support programs that they provide in the hospital, which can increase superior sales growth. The Land Center of the Philippines should also implement tools and processes that will cut the cost of unnecessary processes for financial excellence. And it should be able to improve the knowledge management for employee excellence. Should there be a need to change a certain process for each supported program or supported services in the hospital, the information system team should be able to provide a system that is flexible in handling the changes in the process for business process and improvement. Tracking the employee training and their capabilities will be enhanced as they can easily access the knowledge tool and learn the best practices for business process improvement.